And we are on the line this morning with Dr. Eric Nepute, who is in St. Louis, as a matter of fact. We're going to talk about COVID-19 and its effect on the body and on human beings in general. Conversation brought to you by Marcus and Mack, a law firm representing injured people. Dr. Nepute, good morning.
Well, good morning this morning. How are you today?
Wonderful, wonderful. And it's good to have you on the air with us today. But this is some serious stuff we're talking about this morning. A report says, a study, that men are more likely to be in the intensive care unit because of COVID-19 than women are. And we don't want anybody to be there. Our local hospital, like hospitals everywhere, besieged with COVID-19. And at the Indiana Regional Medical Center, the vast majority of patients are COVID-19. The ventilators are being used by COVID-19 patients. The ICU seems to be filled up at any given time. It's pretty distressing news, and especially if you're a guy, you run a risk, it seems, than ladies might. Why is that?
Well, it's a great question, and if you break it down and look at what we've been talking about really over the last 8 to 9 months, it's all about comorbidities. We know that men have an increase in comorbidities such as heart disease, high blood pressure, high cholesterol, diabetes, and et cetera. And we also know that men typically are going to be more overweight or obese, putting men at a higher risk of severity with COVID-19. I don't know if you know this or not, but there was also a recent study that showed men that have lower testosterone levels have a higher increased risk of infection and seriousness of COVID-19. I don't know if you know, but testosterone for men is way more than just, a sex hormone and for energy. It's part of our immune system response, and it has a lot of anti-inflammatory properties. And so if the 50% of men over the age of 40 have low testosterone, there's a huge correlation between low testosterone and an increase in seriousness of COVID-19.
So when you talk risk factors, obviously we see that as men age, testosterone levels go down. And you mix that in with COVID-19 and its seeming preference to attack people who are getting up there in years. It's sort of like the perfect mix if you're COVID-19 anyway.
Well, you're totally right. And, there's a huge correlation between aging and low testosterone, like you just said. But what a lot of people don't know is there are a few little action steps that you can really take to help boost that and then to lower your comorbidities. Like, for example, there's a huge correlation between low levels of zinc and low testosterone. There's also a huge correlation between low levels of zinc and higher infection rates and higher viral load with COVID-19. I don't know if you're familiar with this, but zinc is actually known as a blocker of COVID-19 from replicating. We talk about viral load. Mm-hmm. So if you have adequate levels of zinc in your system, that actually can keep the virus at a lower level. The lower the viral load, the less infection rate, the less severity of it, the less hospitals, less ICU, and et cetera. So zinc is a big deal for folks to be taking. And I don't know if you heard this, but there was a recent report that showed that if your blood levels were adequate with vitamin D3, that you had a 77% less chance of getting infection in the first place. So, it's very important that we use the common sense measures of social distancing, staying home if we're sick, washing our hands and things like that. But there are other very simple things that have been proven to help reduce the comorbidities, improve our immune system response, which is really the conversation we should be having now. Mm-hmm. And zinc and D3 seem to be a really huge correlator with that.
And zinc is something we begin to take about this time every year anyway, because we know that it helps to reduce, if not the chance of getting a cold, certainly it reduces the severity or the number of days you're going to have that. So people have zinc pretty much on the radar about this time of the year anyway, don't they?
Well, they should. And in fact, my doctor's group, we actually put together a free guide. We call it the Doctor's Flu and Cold Prevention Protocol. And it's basically a guide of things, the nutrients, the top 4 to 5 nutrients that people should be taking and dosages for the average American adult that they can be taking to prevent things. And that includes vitamin D3, zinc. It also includes vitamin C and et cetera. But we also put in there a protocol that is very, very effective if someone starts to get symptoms of any type of virus, whether it's coronavirus, flus, colds, et cetera, because, the majority of people that are getting diagnosed with COVID-19 now, some 80% are diagnosed and said, hey, go home for 10 to 14 days in quarantine. This is something that people can do today to really start helping improve their their health factors and reduce their risk.
Okay, that being the case, I want you to tell us how to get that information right now, and then we want to repeat it before we're done in case somebody doesn't have a pen or a pencil.
Sure. If you just go to freevitamindeal.com, that's freevitamindeal.com, there's a link to the doctor's flu and cold prevention protocol that's there. It talks a little bit more about the benefits of zinc and D and C, but again, freevitamindeal.com.
Okay, so we'll repeat that before we're done here this morning. I wanted to get back, though, to I don't want to get back to the ICU, but obviously that's where this conversation heads, and that's where we began it. When somebody has these extra risk factors, both biological risk factors such as the testosterone levels, and comorbidities like heart disease, behavior-induced things like smoking and other things that are going to compromise your system, you're asking for trouble, aren't you?
Well, you absolutely are. I mean, listen, when you look at the state of America right now, I mean, 2/3 of Americans have some type of comorbidity, whether it's high blood pressure, heart disease, cholesterol, diabetes, or obesity. And really, we've been, and I say this a lot, we've basically been caught with our pants down as a society. The standard American diet and the standard American lifestyle has led us to this risk factor. So it's like Einstein said, if we continue to do what we've always done, we're going to always get what we've always gotten. It's time to start taking some different action steps. And, the comorbidities like heart disease, hypertension, cholesterol, and diabetes, these are lifestyle related diseases. And we know that there is a genetic predisposition. About 8 to 12% genetically is going to have that. But the rest of us, it really is our lifestyle. And we've got to start taking a real serious look about personal responsibility. We've learned a lot with COVID-19. 2020 has been a year of really certainty, clarity, and vision. And one of the things that we know we need now is we need more people less sick. And so there's a huge, huge push to start really helping Americans understand what action steps they can take, why they need to take them, because lowering the risk factor is very important. And multiple sources have said that, this won't be the last time we have some type of a, outbreak or epidemic or pandemic in our lifetime. So we've got to make sure that we're ready, healthy, and we have a good immune system if and when this happens again.
We remember great life-changing events, terrible great life-changing events such as 9/11 and how America rallied around, and we lived differently right after 9/11 than we maybe even do now. It was not long before we were back into some of the old habits that we had. Will 2020 and this pandemic teach us lessons that will last a lifetime?
Oh, there's no question. I mean, there's no question that it will. Really our job now is going to be to make sure that we understand everything that happened during this time. Making sure that the right information gets out, making sure that people do the right action steps. And the key with history is this: if we don't know our history, we're doomed to repeat it. So we're definitely going to be taking massive action steps now and into the future to get more Americans what we call less sick, and to make sure that we're educating people on things like the use of D and zinc and vitamin C and things they can do to get themselves healthier. The world is definitely going to be changed forever. There's no question about that.
Last summer, I started buying my zinc stuff that I get for colds and flus and things of that nature for the family. I started stocking up on it because I figured once we got to this point, and I wasn't thinking of it in terms of COVID, and once we got to this point, somebody starts to feel something. They start pounding that stuff right away. Do you foresee there being shortages because people are going to get this information such as you're telling us today and say, I got to get that stuff, and they rush out?
That's a really great question. As of right now, we don't have any shortages that are happening currently. However, I would encourage individuals to do like you did. I would encourage folks to be smart. Make sure you stock up on your supplements that you need, because D and zinc have such a positive effect on overall health, immune function. Vitamin D is an ACE2 receptor blocker, which means it blocks viruses from even being absorbed in the first place. And then zinc stops the virus from regenerating or proliferating. So those two really are the key. But there's so many other things that we need to be doing to improve our health. It's the zinc and the D things that can be done literally right now to start making some changes.
And we started this conversation talking about guys and how guys are more likely to be in the intensive care unit because of COVID-19 than women are. But obviously, when you're talking zinc, you're talking the various vitamins. It applies to women as well.
Well, yeah. I mean, our standard American diet, which is filled with sugar and processed foods, destroys our immune system, causes inflammation. That's both men and women. So, we need to get back to the basics. We need to be hydrating every day with good water, half our body weight in ounces of water every day. The average adult needs to be taking somewhere around 5,000 international units a day of vitamin D, 20 to 40 milligrams a day of zinc, vitamin C, eating 4 to 6 servings of dark green vegetables, and just getting up and moving your body 10 to 15 minutes every day. That can help with so many problems, whether you're a man or you're a woman.
All right, so we have to know more about this, and you have the resource for us. Give us that information again.
Yeah, your listeners can go to freevitamindeal.com. That's freevitamindeal.com. There's a flu, cold, and virus prevention and treatment protocol. There are things that folks can do naturally to prevent problems, and there's a protocol in there. If someone starts to feel symptoms, what type of protocol and dosages they should start taking. So that's freevitamindeal.com.
He is Dr. Eric Nepute with us here this morning from St. Louis, Missouri, where the Cardinals have pretty much the best logo in all of sports.
Yes, we do.
And they drive me crazy because they frequently beat my Buccos. Dr. Nepute, thanks for being with us this morning.
You have a great day. Thanks for the time. Appreciate you.
Bye now.
Bye.
It is the voice of